Hi there! Have you ever wondered about New Mexico's health services for women and children? Today, I will be your guide to learn more about how Title V works and who it is helping in New Mexico. Let's start with the basics. The Title V Block Grant is a maternal and child health partnership between federal and state governments. A block grant is money that is awarded by the federal government to states. States then spend the grant money on their most important or priority areas and report the results back to the federal government. The Title V Block Grant requires that states submit an annual application in order to receive funds. But unlike many grants, Title V funding is continuously available to all states every year. Now let's talk about the history of Title V. Beginning in 1909, the White House held several conferences on the health and well-being of children and youth. In response, the federal government created laws to improve and protect the health of children and would eventually include women's health. In 1935, Title V was created as the key source for protecting and promoting the health of women and children. Fun fact, did you know that Title V is the longest-lasting public health law in our nation's history? By the 1980s, laws were passed that changed how Title V would receive funding, as well as new rules about how to report on the health of women and children. You may be wondering how New Mexico provides funding for the health of its women and children. Think of it like an umbrella, with the Federal Maternal and Child Health Bureau, which is housed in the Health Resources and Services Administration, on top, and its funded state programs below. One of these funded state programs is Title V, the block grant we just discussed. The Maternal, Infant, and Early Childhood Home Visiting Program, or MCV, is another funded program that gives pregnant women and families the necessary resources to raise healthy children. Finally, SPRANS is the Special Projects of Regional and National Significance, which supports several programs such as respiratory pediatric care centers and pediatric oral health programs. Within Title V, there are a couple requirements for how states spend the grant money. The Health Resources and Services Administration, or HRSA, requires each state to set aside at least 30% for preventative and primary care for children and at least 30% for children and youth with special health care needs. HRSA also requires that states spend no more than 10% on their administrative costs. The remaining 30% of funding is flexible and is given to states to spend on their priority needs. Let's break down Title V funding a little more. We know states receive grant money from the federal government, but did you know that states have to match the amount that they're given? In some cases, states even give more than required. For example, in 2019, New Mexico contributed nearly double what was received from the federal block grant. In order to decide how to spend this funding, states must first complete a needs assessment. A needs assessment is used by organizations for planning and decision-making. It involves determining the priorities of community members and how to best fill their needs. The Title V needs assessment is required by the federal government every 5 years. Now let's talk about data. Data are facts and statistics collected for analysis. We collect data to determine the state's priority health needs. Here are some examples of data sources used in New Mexico's Title V needs assessment. The Pregnancy Risk Assessment Monitoring System, or PRAMS, the Behavioral Risk Factor Surveillance System, New Mexico Youth Risk and Resiliency Survey, New Mexico vital records such as birth certificates, the National Survey of Children's Health, and community feedback. Have you ever participated in a survey? This is just one way that Title V collects information from community members. Data and feedback from New Mexico's tribal communities are represented by these sources through partnerships and sharing agreement. The next step in the needs assessment is the State Action Plan. The State Action Plan is a 5-year plan that addresses the state's priority needs and has several parts. States base their action plan on the following populations: women's and maternal health, perinatal and infant health, child health, adolescent health, and children with special health care needs. Priority needs are the biggest health concerns affecting a state. During the Title V needs assessment, states identify 7 to 10 priorities to focus on for the next 5 years. An example of a previous New Mexico priority was to improve access to preventative dental care in pregnant women and children. After the state identifies its needs, it selects a minimum of 5 national performance measures to address the priorities. There are 15 national performance measures spread across the 5 maternal and child health populations. An example of a previous national performance measure in New Mexico was the percentage of children who had a preventative dental visit in the last year. Next, the state may also choose to write their own state performance measure to allow for flexibility in choosing measures specific to their population. A previous New Mexico state performance measure was the teen birth rate for girls aged 15 to 19, which aligns with the priority of reducing teen birth rates. After New Mexico selects its state and national performance measures, the state creates objectives for each. Objectives are very specific goals used to address the larger priority need. For example, the objective for New Mexico's national performance measure on preventative dental care was to increase the percentage of children who had a dental visit in the last year. After creating the objectives, the state creates strategies for achieving them. The strategy for the previous objective was to promote the importance of oral health through a statewide health education program. For each national performance measure, New Mexico then develops at least one evidence-based strategy measure to determine the effectiveness of its strategies. For example, the evidence-based strategy measure for childhood preventative dental care was to evaluate the number of partnerships created to coordinate dental services. Title V supports maternal and child health through direct care services and by providing resources and support to programs and partners. Let's go through some examples of how Title V is at work in New Mexico. Respite care for children and youth with special health care needs. Prenatal services for expectant mothers. Health education. And newborn screenings. Title V impacts many people in New Mexico. Let's look at who it helped in 2017. 2,068 pregnant women in New Mexico were served directly by Title V funds. 98% of infants born in New Mexico were served through Title V by newborn screenings. 5,039 children with special health care needs were served directly by Title V funds. And an estimated 67% of children 1 through 21 years of age in New Mexico were served through Title V. Thanks for tuning in to This is Title V in New Mexico. If you're interested in learning more about specific Title V programs, check out our other videos. For more information on Title V and New Mexico's maternal and child health programs, here is a list of helpful websites.